Do you ever stop to think about what happens when the code that powers your phone starts making calls about your health? I mean, we're talking about a world where an algorithm is helping your doctor make a diagnosis. And listen, that's not the future. It's happening right now. It's a total revolution. But with every revolution comes one big question. Who's in control?
And yeah, let's be super clear about this. This isn't some sci-fi movie plot. Artificial intelligence is being stitched into the DNA of our healthcare system, doing everything from reading your x-rays to predicting your health outcomes.
And that is where the really big questions pop up. I mean, can you really trust a machine with your life? Is the data it's learning from biased? Does it treat every single patient the same way? The stakes? Well, they literally couldn't be any higher.
So, who's the referee in this crazy high-stakes game? Who's holding this powerful tech accountable? Well, California thinks it has an answer, and it's creating a brand new kind of professional, a gatekeeper to protect all of us.
Okay, so let's dive into the problem here. AI is changing medicine so fast it'll make your head spin. But all this amazing innovation, it doesn't come for free. It comes with some serious risks.
And we're not talking about small risks. We're talking about huge legal and operational landmines. Just think about it for a second. What happens if an AI model trained on biased data misses a sign of skin cancer on a person with a darker skin tone? Or what if your most sensitive health data gets misused? The potential for real harm here is just massive.
Because of these risks, the old Wild West days of AI in healthcare, they're over. At least in California. Regulators are now actively on the hunt, auditing for any ethical slip-ups. The message from the state is loud and clear. If you're going to deploy AI, you better have robust oversight. No more excuses.
So how is the state pushing back? Well, California isn't just sending out friendly warnings. No. It is laying down the law, creating a whole new rule book for artificial intelligence in medicine. What you're seeing here is basically a legal fortress being built around you, the patient. You've got laws demanding that AI decisions have to be explainable, no more of those mysterious black boxes. You've got other rules that say doctors must tell you when AI is being used in your care. And maybe most important of all, laws like HIPAA demand hard proof that these systems aren't discriminatory. It's a total shield designed for patient protection.
Okay, so you've got all these new, complex legal rules. Who on earth is supposed to navigate all this? This isn't a job for just an IT person or just a lawyer. It demands a new kind of expert, a hybrid specialist, a brand new profession born out of pure necessity.
So, meet the California Certified AI Compliance Officer. The best way to think about them is as an ethical architect for AI. Their entire job is to build and maintain the paper trail, the documentation that proves a hospital's AI systems are safe, fair, and totally legal.
And listen, this isn't some minor desk job. The organizations training these folks literally call them California's frontline defense mechanism. They are the human guardians standing right between this incredibly powerful technology and you, the patient.
So what does one of these officers actually do all day? Well, it's probably not what you think. It's not about writing code. It's about creating a paper trail of accountability. It all comes down to creating critical, essential documents. And get this, their most powerful weapon in this fight for ethical AI is the humble PDF. Yeah, I know, it sounds almost ridiculously simple, but these documents are the concrete, physical proof that an organization is taking AI safety and fairness seriously. So first up, their job is to find problems before they can actually cause any harm. They crank out these detailed risk assessments to map out what could go wrong, and they conduct these deep dive bias audits to hunt down any hint of discrimination. They even create checklists to make sure any AI a hospital buys from an outside vendor meets California's super strict standards. Next, they have to tackle that whole black box problem head-on. They create reports that explain in plain English how an algorithm actually works. They write the data privacy notices we all get, and they even design the exact templates doctors will use to tell you, the patient, that an AI is part of your care.
And finally, they build the internal rulebook from the ground up. They're the ones drafting the official policies for how AI is governed. They create the forms for reporting any AI-related safety incidents. And, so important, they document exactly how a human expert is always kept in the loop, maintaining oversight over the machine's decisions.
So let's zoom out. The bottom line here is that this is about so much more than just paperwork. It's about building an entirely new foundation of trust between us, the patients, and the technology that is fundamentally changing our medical care.
And the mission behind this whole movement is incredibly powerful. To make sure that safe, ethical AI isn't some luxury item that's only available to rich, fancy hospitals. The goal is to make it a public good, a basic right for every single patient, period.
But here's the catch. To make it a public good, you have to tackle the cost. This kind of super specialized work is crazy expensive, which is a huge barrier for smaller clinics and hospitals. That's why the nonprofit spearheading this whole thing is offering these critical services at a massive discount, making sure that community health centers and public hospitals don't get left in the dust.
And what you end up with is this amazing win-win. On one side, you've got healthcare providers getting the tools they desperately need to use AI safely and responsibly. And on the other, you have a whole new workforce of certified pros building careers doing really meaningful public benefit work. It's fantastic.
Which leaves us with one final, really big question. By creating a certified, human-led profession whose entire job is AI oversight, has California accidentally created the blueprint for the rest of the world? Is this the model for how we make sure artificial intelligence actually serves humanity, not just in our hospitals, but everywhere? The experiment is officially underway.